Scientists have found it hard to develop drugs to treat ALS because it's difficult to replicate a patient's condition. Tuberculosis, or TB, calls to mind a disease from the past that killed tens of thousands of people. But TB is still the #1 contagious disease in developing countries. The World Health Organization says some 8.8 million new patients were diagnosed last year, and that 1.4 million of them died. Up to 80% of the patients were found in 22 countries. The situation in regions such as Southern Africa and Asia is especially serious. Japan has succeeded in keeping TB under control due to a nationwide campaign dating back to the 1950s. The country's experts decided to develop a training course half a century ago to share their knowledge. NHK World's Tomoko Kamata reports.
On the other hand, we also face
Delegates from countries with a high prevalence of tuberculosis discussed the current situation in a symposium in Tokyo.
on behalf of the
Participants from Indonesia and Uganda reported that thousands of young people who make up critical workforces are killed every year by TB.
We must strengthen our ability to detect and treat all cases.
The TB Research Institute in Tokyo holds an annual 3-month course for doctors. Public health experts from around the world come to learn how it's brought TB-related deaths down from a pandemic level to almost zero.
And the quality, if you do the active case finding in the community, they found the data like this.
Doctors from 14 countries participated this year. And some 2,000 physicians from 97 countries have completed the course. Among them is Tonderai Murimwa from Zimbabwe. His country has one of the highest TB infection rates in the world. The number of patients has increased 6-fold in 20 years. An HIV infection doubles the risk of contracting TB. HIV's prevalence in the country is the reason behind the spread of the disease.
The way to use data, analyzing data, identification of problems, that is a major thing that we are here to learn.
Murimura took part in a lecture focusing on TB countermeasures in poor communities. Most developing countries like Zimbabwe are desperately short of doctors. So many countries recruit and train basic healthcare workers in communities to monitor TB patients in their homes. They make sure medicine is properly taken until the patients are fully cured. Murima and his peers discuss how they can help community workers do a better job.
Financial sustainability.
Financial sustainability is an issue.
Yeah, especially this is in low-income settings.
Yeah.
Even volunteer, they need to access to the patient's house or health facility.
Most of volunteers are poor. But if you give them money, maybe they will put the money in the pocket and do nothing. Maybe.
Coming from low-income.
Murima says he learned about how physicians in other nations deal. He says this information will help him draw up anti-TB programs to prevent transmission from neighboring countries.
We understand the right ownership.
Murima says he's developed bonds with his colleagues facing similar challenges. He says he'll call on them for advice in the future.
I am hopeful. Things are looking up, and with more support, not just from in-country, but the region and international partners, I think we can make significant strides in reducing the burden of TB.
Participants will finish the course on Friday. They're vowing to continue the fight against TB with a renewed sense of urgency. Tomoko Kamata, NHK World.
Sharp and Sony were once considered the leading manufacturers of flat panel TVs, with the